Hi, everybody. Thank you for coming today for my internship presentation. I am Shruthi Srinivasan, and I'm doing my final semester in biomedical and health informatics at UNC Chapel Hill. So this is the agenda for today. Well, just a little bit of background about me, the internship, what project I was working on, what deliverables was used, the stakeholders, and the next steps and hurdles and lessons learned. So I did my undergrad in biomedical engineering from India. I'm an international student. So after that, I worked for 2 years in a informatics solutions company, setting up clinical study in EDC. And currently, I am doing my master's in biomedical and health informatics. So on campus, I had the opportunity to work as a TA in quality improvement data visualization, which is a lot of Tableau. And then I was also a research assistant in a laboratory of applied informatics research. We were mainly focused on maternal health. And currently, I'm interning at the Sheps Center for Health Services Research. So I'm doing my internship at Cecil G. Sheps Center for Health Services Research. It is a unit under UNC. It deals with a lot of program areas like mental health, primary care, aging and long-term care, along with rural health research. But I was mainly working with George and Christy under rural health research. So this is the project overview. I was mainly focused on rural hospital profitability. The data source that the data that we used was sourced from CMS Healthcare Cost Report Information System. So this data set, I received it from another member working at the Sheps Center called Anne. So they gave me the data set. This is on the right, you can see a snippet of the data set. So the data set contained like 4 years from 2018 to 2021, included the rural and urban hospitals and their profitability. You can see it from the operating margin and the total margin variables. And other variables that we focus on from the data set would be ownership, that is government-owned, profit-based or not-for-profit based. System affiliation, whether the hospital was affiliated to another health system or not. Do they provide long-term care was one other variable. And another variable is, do they operate a rural health clinic? So these are other variables that we focused on. And profitability, we focus on the total margin that is present in the data set. Also, another important point would be that this data was collected throughout the COVID years, meaning we have 2 years pre-COVID and 2 years post-COVID data, during COVID data, sorry. So these are the deliverables and tools and methods. So so I had the data set and I was involved with visualizing the data set to study the profitability of the rural hospitals. And so I mainly used a lot of Excel for the data visualizations, as you can see on the right. Just a small example of the kind of data visualizations that I did. So there's a box plot that gives the distribution of the total margin of the years 2018 to 2021 of rural hospitals and urban hospitals. And this, the bottom graph is another example of other variables studied in detail, that is system affiliation, whether the hospitals, studying the profitability of the hospitals based on whether they're affiliated to a system or not. So mainly worked with Excel a lot for the data visualizations, and then other deliverables included writing 3 briefs. So currently I've completed brief 1 and 2, and brief 3 is in progress so far. So brief 1 would be the general profitability of rural and urban hospitals based on their Medicare payment designation. And then brief 2 is studying the profitability of rural hospitals in detail based on ownership and system affiliation. The third brief is in progress. It deals with RHC and long-term care of rural hospitals. So these are the deliverables and tools and methods. So the tools I used was, as I said, Excel. And for the write-ups, I mostly used a lot of, read a lot of articles, a lot of research and literature review went into that. So, the stakeholders for this project would be, since we're dealing with rural hospitals, access to these communities, like healthcare access to these communities, so rural communities, and healthcare systems, because we're talking about profitability of hospitals, and then policymakers, so that they can look at the data that been generated, like study the trends and come up with any action items for that. And public health departments and other researchers who are interested in this as well. So next step would be continuing the third brief. And so right now, we only studied the other variables with respect to profitability, but maybe looking at what influences that in detail would be a next step. And hurdles, this is a very new topic for me. And I felt like there was a lot of things that I needed to learn, like a lot of background, but it was easy to understand few topics, but it took a lot of time to get used to the concepts. And I think it would have been nicer if I had more time to work on like digest everything a little more slower, and then try to produce a better, say, visualization or a brief. So that is one thing I feel sad about. But so I would like to thank George and Christy. They helped me so much throughout my internship period. I learned a lot. They were very patient with me. So thank you so much. And Javed, he's the director of the internship program. He gave me a lot of advice when I was working as RA for him. And Marielle, thank you so much for all the last minute questions I would ask you for the internship proposal. And Erica, thank you so much she was me from beginning to the end, I feel. So thank you so much for helping me throughout the journey. So that's it.